Hi, friends. Welcome to your weekly Motivational Moments with Eric Vickery, President of Coaching at All-Star Dental Academy. This week, I want to talk to you about killer words. These are words or phrases that limit your effectiveness. And we talked about significance. We talked about you're only as effective as you can communicate a couple weeks back. And I want to make sure that we're really clear on this. There are words that you are using that are killing your effectiveness. They are words or phrases that give patients an out. Things that reduce the significance or the severity of the diagnosis. Things that make it sound complicated. So I want to give you 3 categories of these limiting terms. Number 1 category is anything that minimizes the severity of it. If you can't use the word pregnant at the end of the sentence, that's a problem. You have a little bit of pregnancy going on here. You have a little bit of bleeding. Okay. Category 2, filler words. These are words that are put in place by you. You have no idea you use them. For me, my killer words are or things that devalue my communication skills. For you, it might be just, possibly, kind of, maybe, might want to think about someday considering a slight chance of doing this. Number 3, these are words that are your technical jargon. Well, you have an MODL amalgam with defective margins with a class 5 buckle that needs a crown, right? And so patients are going to pick up on the words that you're using. They're going to create a foot in the door to say, no, thank you. I don't want to do that. It doesn't sound impactful. And these are why you're hearing things up front like, oh, yeah, it's not really bothering me. I think I'm going to wait. So your action this week is to write down on a whiteboard, on a chart, on your desk, anything you hear that is a limiting phrase that your team members are using. Don't write their name, just write down that you heard the word that they're using. And then start looking at that and saying, okay, you walk in the room, you see on the whiteboard, you see little written down 17 times. I wonder if I'm saying little or kind of or possibly or literally. If you're literally using that word over and over again, it loses its effectiveness. So start communicating as a team. Where are you struggling with these killer words? How can you improve upon them to improve the effectiveness you can communicate, which will then in turn improve how effective you are with case acceptance and getting patients healthier faster. All right, guys, make it a great week. Watch out for those killer words and have a killer week. Take care.
We hope you enjoyed this episode of Dental All-Stars. Visit us online at allstardentalacademy.com.